Welcome to Be Now. My name is Don McLeod, and it's Tuesday, January 4th. As usual, I'm joined by Fazell Khan. Fazell, how you doing?
Hi, Don. Thanks for introducing me. Happy New Year, by the way.
Yeah, Happy New Year. What did you do?
Like you, Don, I stayed home. I stayed in my basement, and I didn't come out.
Yep. There wasn't too many fireworks this year. It's like around my place, maybe 10 or 15 years ago, fireworks would be going off all over the place.
There were fireworks in downtown Brampton. You probably
No, I realize that, but I mean, on a normal basis.
Yeah, you're right. Not as much as on July 1st or Diwali.
Diwali's a big one now.
Okay, so Don, we have a guest today. I'll let you introduce him.
Yeah, Doug Ford's restrictions come into play again for the next 3 weeks, so we decided to talk. We wanted to talk to Jason Rosso. We've talked to him before, but probably about a year and a half when the restrictions came in and this whole COVID thing started, and talked to him about how the restaurant business is going to be impacted. I never thought that about a year and a half later we'd be talking to him about the same situation, but here we are, and welcome, Jason.
Hey, Don, thanks for having me. Thanks, guys. Thanks for having me on. I appreciate it.
No problem. You operate, one of the best restaurants in Brampton. It's called J Red. It's a great atmosphere, great food all the time. Every time I go there, it's great. But these restrictions, once again, give you a kick in the teeth. Like, how are you dealing with this over the next 3 weeks, or are you dealing with this? And is it something that, long term, if it keeps on going, you just throw in the towel and say, forget it?
I'll be honest with you. It's this round of closures so quickly were quite surprising to us. Like, for me, it was really unusual to have this come down the pipe so quickly. I was not expecting it. I expected maybe some drag out, some talking about it, lots of different stuff, hearing in the news and stuff like that. And to go right from like 0 to 100 miles an hour overnight was pretty crazy. So, we're used. I hate to say it; it's a terrible thing to say, but we're used to not doing business. We're used to being locked down, which is a terrible thing to say. But the reality is that it's sort of like put it on the pile. It comes back to you again. We were just getting our legs underneath us. It gets taken out from us again. We weren't really ready for it. So what I'm going to do over the next little while is really still sort of up in the air. I don't have a concrete plan. Yesterday the first thing I did was reach out to my staff and I said, listen, you got to let me sit on this for a little bit to figure out what a game plan is for us. But I've got 26 people that work at J Reds that all of a sudden are not going to be working. 2 or 3 of them, we're probably going to do takeout only. Takeout business is not really great for us. J Reds is not really a takeout restaurant. I refuse to use the delivery apps because it's highway robbery for us. Like, we lose money on every transaction. So, with this round of closures, like we really don't have a lot of infrastructure in place to handle another set of closures. We came off of such a long, 16 or 18 months of being closed. We put infrastructure in place and flow in place to manage that. And here we are back open again from June. We weren't doing great, but we certainly were open, generating a bit of revenue, keeping people employed. And then all of a sudden that's taken away from us again. But within that sort of 7 months that we were open, or 6 months that we were open, we had sort of let a lot of our sort of, lockdown protocols move away, stuff like online ordering platforms. So we didn't need them because we didn't expect to be like all of a sudden go from 0 to 100 miles an hour and being locked down again at the blink of an eye. So
you're not the only one that's confounded by these new, this new lockdown procedure. It makes no sense to a lot of people on a regular basis. We're taking a look at, like gyms, restaurants, schools are online, but malls are open. The Amazon factory is still operating. You got the malls they're still wide open. You got the takeout. Is there any during that time period that we last talked about a year and a half ago? You've done your protocol. You've done everything that the government has asked you on a regular basis. Has there ever been one COVID case traced back to your restaurant?
Not a single case that we know of. Nobody's ever called us. The health department has never called J Reds. We've never had a reach out from any official saying you've got a suspected case of COVID. And I know what these things look like because I have kids in school. So I got 800 of them a week last year. So I know exactly what the health department says. Never once did we receive a letter saying that somebody at J Reds contracted COVID or had COVID and possibly infected anybody else. So it's really perplexing, I just don't understand why restaurants keep getting the focus. I understand it's a social business. but I mean, we were following protocols, we're social distancing, we're checking vax passports. At what point do you do enough? Like, I'm double vaxxed, we're checking vax passports, like boosted, like we're doing all these things. And it's like, I'm sorry, you're still getting locked down. It doesn't make any sense.
Yeah, well, like I said to you before, it makes, like, for a lot of people, it makes no sense. I mean, if you look at Twitter or Facebook and see what's going online on the social media, people are just confounded. Like, why? All of a sudden, before you go in the 1st of December, it's not like you didn't know that Omicron was coming. And, the last minute second, even school for, I pity the poor parents for the kids in school. Now they have to transition to online learning instead of actually putting it makes no sense to me on what this government and any government done at any level for the last year. I give them the first year as a benefit of the doubt, saying, you know what, okay, it's a live and learn type thing. But in the second year, there's no way that this should be going on.
Yeah, for sure. I mean, you've got professionals, like these guys are epidemiologists and professional. They're doctors, they're researchers, they're way smarter than I am and way smarter than lots of us. And somehow we got ourselves into this mess again. Like, are you trying to tell me you can't understand how this flows? Or like, and I get it. There's lots of moving parts to this, and there's lots of international sort of things we can't control that affect these kind of things. But at the end of the day, like, at what point do we just say we have to start living life and like, we're doing all the things that you've asked us to do, and how do we keep moving forward, right, instead of backwards, like,
I mean, I heard
were
one of the
you ever
business
allowed to go to full capacity since the shutdown started?
So what happened basically is when we opened in June of last year, we opened at a 50% capacity. But the reality is that, and that never really lifted per se, but the problem is most restaurants is, especially with J-Reds, that capacity rule was only a problem for restaurants that are little, that have 20 seats and 15 seats. For a restaurant like J-Reds, 50% capacity is not a problem, and I mean, I hate to say it, but the reality is we never actually hit 50% capacity, even when we were trying to be open, and we weren't turning tables away. Never once did we ever say to somebody, I'm sorry, we don't have a table for you. Because at no point were we ever at 50% capacity when we opened the doors in June,
Yeah, and that's one of the areas where I think with this current lockdown, they should have allowed you to, maybe cut back from 50 to 40 or 30. But as you said, 50 in your space, there's a lot of space you can have between tables, right?
Yeah. I mean, with J-Res, we can still get 90 or 100 people in the restaurant and all be 6 feet apart. The restaurant's huge, right? And I know that other restaurants don't have that luxury. Also, the pain of suffering and having a restaurant that big. I mean, there's two sides of the sword for that, right? But yeah, I mean, from my standpoint, it's sort of like, ever since we started having these vax passports, we've had, from the restaurant standpoint, we've had nothing but knocks against us since we've opened the doors. It's been, capacity limits. It's been table seatings. Like, you can't dine with anybody that's not in your table. Then it became the vax passport. The vax passport, as much as we enforced it, was really damaging to lots of restaurants, Maybe not in big urban centers like Toronto, where, we have critical mass of lots of people vaccinated, but in suburban markets where there's a mix of people vaccinated and not vaccinated, you're alienating your clients, right? You're telling people you can't come into your restaurant, right? I mean, it's a really crappy position to be put in. So ever since we opened the doors, it's been one thing after the other, but we've done it and we've enforced it and we followed the rules. So it doesn't make any sense to all of a sudden be like, well, I know you follow all the rules. I know you've done everything you're supposed to do. I know that we haven't had a case of COVID in your restaurant, but we're shutting you down.
Yeah, and that's the other thing is, I mean, something like Tim Hortons or the drive-throughs, they don't have to deal with any vaccine passports. They don't have to deal with any of that stuff. People are driving through, they're getting their stuff wherever they want, and it's like that's taking business away from local businesses. It makes no sense at all, and it's even getting more convoluted in money. What about support from the federal and provincial government? Is that something you can tap into now, or is that something that maybe is up in the air?
So the first round of business subsidies that the federal government put out for I want to say the first round of COVID ended in October of last year. That was the last month you could apply for. So November was really left hanging in December. In December, the federal government put together a new bill that passed with specific funding programs for hospitality businesses called the Hospitality and Tourism Recovery Program. And it's geared only towards anything in the hospitality industry, specifically restaurants, but hotels and all those other things as well. You can apply in. It sort of reactivates the 75% wage subsidy and 65% rent subsidy. So we're eligible. So that became live just before Christmas. So I was able to apply for that, for some subsidies to try and help keep the business going. But I mean, previous to that, I mean, we're down we're down. Our collective business is down almost 80%. 77.6% is our collective business decrease since COVID started for J-Reds, which is like insanity, right?
So Jason,
that's
how
even
long,
being open last year.
How long can you go like this? Like honestly now?
To tell you the truth, we can't. You can't. We're sort of running on fumes. I mean, from my standpoint, the business it's a cash flow business, and like it's never been super profitable. So you don't have a nice big fat wad of cash you're sitting on for rainy days in the restaurant business. Lots of businesses don't have that, but lots of businesses do. But restaurants don't, in my experience. And like, so when you go through your cash flow, it goes. So if you don't have cash flowing in, there's no cash flowing out, and you can't pay people. You can't pay the rent. I mean, I've been kind of lucky at J-Reds. I've got an amazing landlord who's really supportive. But the reality is that everything still costs money. Whether it stays open or closed, it's still costing me 25 or 30 grand a month to exist in the space, whether I'm open or not. Right. At some point, you're not even doing enough revenue to cover that expenses. So you're putting your own money in. So the reality is that, it doesn't have a long life. It doesn't have a long life. And frankly, you got to ask yourself, like, what is it worth anymore? If I was 20 years younger, like it would make sense to do it. But I mean, there's lots of guys like me, 50 years old, that have been in the restaurant business for a long time. We're sort of comfortable with the restaurants and we're doing fine. And then this hits, it screws the restaurants. And at 50, you're sort of like, you know what? I don't know, man. Do I really want to go on and do this? Do I have enough driving me to get back and fight like I'm opening up a restaurant again? Is there people coming back out? Like, who knows, right? Who knows? There's so much uncertainty,
Yeah, and the other thing is going forward. I mean, you know that the food costs are rising as well. That those are going to have to be passed along as well, which is only going to increase, your cost of product.
Well, it's interesting. I have this conversation a lot with many people in many different industries. The restaurant business is, it's not that I'm sitting here. I certainly don't want to be, sounding like I'm woe is me and woe is all of us in the restaurant business. But the reality is that it's a tough business to be in. It's a business of passion. It's a business of entertainment. It's something you do because you're just obsessed with it. It'll never make you lots of money. The problem with expenses is in any other business is that, when something costs more money, it gets just translated to the guest or the consumer. You buy a Mustang 7 years ago, it was $45,000. The Mustang today, same car, $65,000, because that extra $20,000 is what it costs for it to produce it and their profit built in. Restaurants don't get to do that. Restaurants aren't like, when I opened J-Reds, our signature burger, the Bob and Doug burger, was $17.95. It's $19.95. $2 in 7 years. And all I hear is grief about how the prices have raised, right? Just recently, with going into the late fall of last year, I had to put the prices up, which is higher than we've ever put the prices at J-Reds because we don't have a choice. I got lines cooks making 20 to 30% more an hour than they were before. Product right across the board, we have a 34% increase in cost of product right across the board as an average, which is pretty crazy when you think about it. But that's got to go somewhere. You can't just absorb it, right? That $17 burger just doesn't work for you anymore. Now it's got to be 22, right? So,
yeah. Okay, yeah, so Jason, I know we only told you we'd have you on for 10 minutes, so we appreciate your time. We know you're busy. You got a lot of stuff to figure out. I'm going to just pop up your website there.
Yep.
You're not open tonight, but everybody who's watching now or watching later, put J-Red & Co. on your calendar to order sometime this week or the coming weekend. It's great food. Don, I know we were supposed to visit J-Red over the holidays for a team dinner. Maybe we'll do something takeout.
Well, we will. So what are your hours for takeout, Jason? Are you restricted hours? And
yes. So we're going to run, we're going to start Friday. So we're going to be closed until this Friday. We're going to open Friday from 4 until 10 o'clock for takeout. And we're going to do that moving forward Tuesday to Sunday. So we'll be closed Monday still as usual. For the most part, we're trying to keep our hours as reasonable as possible. So it's 4 to 10, basically every night of the week except for Monday.
So can people phone ahead their order and pre-order?
Yep. Yeah, you can check out our website. Our menus are on there. We did a little bit of condensing of the menu just because it's really hard for us with the uncertainty to be carrying a huge menu like we normally have. So we could cut it down. Still got all the favorites on there. Still got all the signature dishes on there. Stuff like oysters we can't do because we just can't buy them. If we don't sell them, they're garbage, right? So, but we still got great menu selections. And you can pre-order. You can call in. The kitchen team is pretty good. Joel, the chef, is amazing. His team's amazing. They're pretty fast. So, you don't have to pre-order. You can if you want. But for the most part, you can call in and come pick up. We're thinking about doing a delivery thing as well at some point, but we're going to wait and see how this rolls out, So.
All right. Well, good luck, Jason. Thank you for joining us. And as always, your place is always good. The food is great. So for those who haven't experienced it, go on the website, check out the food. The Thai Fighter, I think, is one of your best sellers.
Yeah.
Popular I've had that before.
Yeah, popular
dish. Chicken. I like the chicken wing cauliflower. I don't know if you still have that on the menu.
Oh, that's
the cauliflower. That's all I got him. It's our best selling item.
Perfect.
All right,
All right,
thanks,
Jason, thanks for joining us, and we'll talk to you hopefully in the near future when everything goes through and gets, if there's some clarity in a month from now, we'll see what's going on.
All right, awesome. Thanks for having me on.
Thanks. All right, Don. Geez, that's tough to be in the.
Yeah, it's tough. Restaurant businesses, I think it's like there's 50% or 60% failure in the first 3 years. So it is a tough business. I mean, you know, we wish him luck. He's got a great restaurant, and All-Star Bar and Grill in Brampton is pretty much doomed. You know, there's a lot of bars and restaurants in the Ontario region, especially Toronto, that have taken a real big.
But you know, Mike has a good point here, right? We all kind of have to eat, right? You know, once in a while, definitely support the local businesses. Eat out. It's tough, you know. I just don't know what to say to Jason, because I know early on in the pandemic, he spent a lot of his own money and time and resources making free meals for seniors and delivering and all that stuff. I remember that.
Yeah, and we talked to him at the very beginning, and by that time we hope to be done. So anyway, we're going to leap into our next topic, which is William Osler and their Code Orange to address capacity pressures and staffing challenges. That press release came out yesterday by William Osler. I know Mayor Patrick Brown was talking to several outlets about it. It was all over the news. I read the release, and it doesn't say a lot. It just says that patient volumes across Osler and staffing challenges have affected the hospital's capacity. Now,
so that means more hallway healthcare, long lines.
Well, we've already had. I mean, you know, William Osler and Brampton Civic is famous for hallway medicine and the code gridlock that has been happening in that hospital for what, 5-10 years now, where they haven't enough beds and people are in the hallways. So now with our code gridlock, we have code orange as well. And apparently the head of William Osler was talking about the nurse to patient ratio on a normal basis is 1 nurse to 4 to 5 patients. And recently, because they had to institute the stage 2 of Code Orange, it was 1 to 10. So 1 nurse for 10. And that was basically for them, it was not efficient, and it would, you know, be a problem for healthcare. My big thing is they don't tell you why the staffing challenges. Is it because they don't have enough nurses? Are the nurses basically, you know, walking off the job? Are they getting COVID? It doesn't say in this press release why they're down to 1 in 10.
Yeah, and Karen is saying, I don't call it absenteeism. They're home for a reason, right? Either because they're sick or they're maybe scared. I don't know. As healthcare workers, I doubt that. But
well, Bill 124, basically the nurses, you know, they were talking about, you know, it limits their wage increases, and they weren't happy with that, right?
Yep.
So the problem is Bill 124 limits their wage increase of public service, which includes the nurses. But at the same time, you know, you have CEOs of hospitals, and you have the LHINs and the Ontario Health, all the bureaucrats. They are not subject to this Bill 124. Right.
And, you know, and where are these people making, you know, close to 7 figures to run these hospitals? Where are they to explain what's going on? Why weren't they prepared? This has been 2 years in the making. We knew that in Brampton, especially, the issue was there prior to the pandemic. It could only have gotten worse, and it did. And 2 years later, now, you know, we're preparing for who knows what.
Well, the thing is, I've lived in Brampton, you know, since 1993, and healthcare has been on the burner for that entire time. You know,
yeah. So there's a lot of blame to go around, but in the last 2 years, right?
Yeah.
You know,
so in the last 2 years, like I said,
remember when they had the tent out at Brampton Civic in preparation for the flood of people, and they were going to triage people outside, and we've kind of gone away from that.
No, they took that down and moved it away.
Yeah. One of the things I found interesting was a tweet by Mayor Brown. I'm going to see if I can get it on the screen here.
Okay. So
he shared this, and this is one of his most popular tweets. I haven't seen one of his tweets go like this recently, you know, over 5,000 likes. But basically saying, you know, Canada ranks near the bottom on a per capita basis for the number of beds in our healthcare system.
And that's been going on for 20 years.
Yep. And it's clearly the issue here, right? Because I think especially in Brampton, our ICU capacity was already at 90% before the pandemic. So, when we complain about the ICU beds getting filled, it's not because, of the COVID only patients, right? It is because it's already 90% filled with patients who have other issues, not
Well, that's
necessarily
the whole
COVID
thing.
issues.
It's like, we've been, like I said, I mean, the Bramptonians have been whining and bitching, complaining about our lack of beds and hospital capacity for 20 years. And then we all knew that the federal government basically was responsible for transfer payments to healthcare to the provinces. And even Kathleen Wynne, I remember talking about this. It used to be close to 50% transferred from the federal government to the provincial. Now it's only 20%. So that's why the big discrepancy. And then in the meantime, that 20% gets diluted because now you have a bureaucracy with the LHINs and the CEOs. It's like an upside down pyramid. And at the very point is the patient at the very point at the bottom. I remember 2 years ago, we talked to Dr. Kavinder Gill about this very situation in regards to seniors and the lack of seniors help across, and the lack of beds, and the lack of nurses and everything else in Brampton. This is not anything new that Patrick Brown is saying. We've known this in Brampton. Anyone who's lived for any length of time in Brampton has known this.
Yeah. Crystal's asking if our two conservative MPPs have said anything.
You're not going to hear anything from those conservative MPPs. But at the same time, the Liberals in I remember the last election before they lost, I remember Harinder Malley and all these other Liberals talking about, yes, we're going to get you another hospital. Before that,
it always comes at the end of the term as an election promise. They lose, we don't get it, or the new, the same thing is going to happen this time, right? A second full-fledged hospital in Brampton, or even a third one, is going to be an election issue.
Well, I mean, they're not completing that hospital that they say is a hospital, but it's only 250 beds in a cancer center. That's only due for completion in 2027, and that's probably, even though there's a tender out, I mean, that could be canceled by the next provincial government if that changes. Who knows?
Well, and even if we had those beds now, it's not enough. Let alone
exactly. It's like, you're okay. So now you're 90%, and you're going to code orange. So someone who has a heart attack or something like that, basically, they're transferring patients to neighboring hospitals. So again,
when I see the mayor tweet something like this out, he's taking a stand here, right? He's put himself out of the limb to criticize the current situation, which means, and there is an election coming up here in Brampton as well in the fall. So no doubt this is going to be a big provincial election issue and also a municipal issue. And hopefully this means we're going to see. So I've seen Councillor Santos kind of retweet this. No doubt anybody who's running to replace anybody on Council Now, healthcare is going to be the number one issue, I think.
But like I said to you before, I mean, this is happening since 20 years. I mean, you take a look at the healthcare system, and good for Patrick Brown for pointing it out. But here's the thing. There's a lot of people that have been pointing out over the last 20, 30 years how our healthcare system has declined against other industrialized nations. And what happens? They get shouted down and says, "Oh no, we get the best care, healthcare in the world," and "Oh, you're trying to get a two-tiered system." Reality is that we don't have the best healthcare, and the one thing with COVID, it has exposed a whole bunch of holes in our system on a regular basis, and we're back to square one again. We're going around in a circle with this COVID and lockdown. And do you think that in 3 weeks, this lockdown is going to be any help in regards to getting
the numbers are going to be
worse?
Control? The numbers are going to be worse, which means they can't undo the lockdown because they would look bad, right? But it's not a strategy anymore. Locking down is not a strategy anymore. You've got to be honest, I don't know what a strategy is anymore because it just seems to be ad hoc. I'm not a public health official. I'm not getting paid, $1 million to run a hospital. These are the people that should be coming out with the solutions, and they're not.
Well, here's the thing. I mean, why? A year or 2 years into it, do you have a code orange, and all of a sudden, within 2 days, it's a code orange? What you didn't, like 3 months ago, we heard of the Omicron virus, and it was very contagious. This is the normal people, and we're saying, well, okay, well, maybe you should get ready. If I know a storm is coming, an ice storm or a snowstorm is coming, I go out, I make sure I got the salt in the garage, I got the shovel ready to go.
But the issue here, Don, is lack of healthcare workers, right? Because they're homesick. So how do you
Well,
solve
either
that?
they're homesick or they're saying, you know what, Bill 124 by Ford is not getting us any more money. Then maybe, you know, we're going to stay home. Maybe it's a work to action. I don't know, but there's
Or, you
nothing in
know,
this
the
press
healthcare
release.
workers don't want to come in and take up twice the amount of load that they would normally, that they should be working with, right? So they're the ones who's bearing the brunt of this, unfortunately, right? The nurses, you know, just the general hospital staff. You know, I think the doctors, you know, some of them are probably doing much better than they were before, right? Because they've got a lot more business. A lot of them are on social media, growing their accounts. I would, you know, and they're all arguing. You know, I tweeted about this on the weekend. A policy, public health policy comes out. You got one side of doctors complaining about it, another side says it's not good enough, and the public is left in the middle with your hands up in the air. No, I don't know what's right, what's wrong anymore.
Well, that's the whole thing. I mean, you know, like why are you shutting down gyms when basically, you know, gyms and schools? So schools are closed, but malls are open. You know?
Well, and you know, I was talking to you earlier. I was at a big box store on the weekend, full. Could not get more people in there. The express checkout lanes all full. There's a lineup behind there. Everybody's wearing masks and all that, but what we're hearing now is you should be wearing an N95 mask. The cloth masks are useless, right? The number of people I know now that have gotten COVID, right? It's unbelievable.
Yeah, and you know what? People are had it up to here. I mean, I've had COVID. I'm double vaxxed. My wife is double vaxxed. She's had COVID. I mean, we've gone all
I'm
through the
triple vaxxed. I don't know if you got the booster
triple
yet.
vax. So yeah, you're getting another booster, but you can't booster forever. I mean, now they're talking about 4, 5, 6, 7, 8. Like that's insanity.
Four, not 7, 8. We're at the 4 in Israel, I think.
Yeah, 4 in Israel, but now they're talking. It's like, guys, this is insanity, right? I mean, at some point in time, even the most even-keeled people are going to revolt, right?
Me, right? I was even keeled. Now it's like you know, if I'm, you know, we got the shot during the summer, and I know a lot of people, a lot of students. You know, I heard through the grapevine were out and about, and they were tested positive over the holidays.
Yeah, well, you know what? To me, it's like it's a ridiculous scenario. If the Omicron is something that is basically a common cold, there is no reason, absolutely no reason.
You know what?
It's
not the common cold, Don. I hear that a lot. It's not the common cold. It is serious for some people. Traditionally,
well, so is the flu. I mean, if you're over 85 and get the flu, you can die.
You don't hear 50-something-year-olds or 40-something-year-olds dying of the flu, but you do with this virus.
Oh, you can die from anything. That's the point. We're only human. We're going to die from something anyway.
I think they said 1% of the population will get like a adverse reaction to it, which is enough to overwhelm our healthcare system, and that is the problem.
That is a problem. If 1% is a problem for overwhelming the healthcare system, we have a bigger problem. And back to our original topic about a code orange.
Okay, Don, we're at 28 minutes. We can keep whining and all night long.
I know. It's you know, but you know what? People are frustrated. They're angry. They're frustrated. And, you know, like I know a lot of people, there's some people that we know that are afraid, have been afraid to go out for 2 years because they're afraid to get COVID, right?
And there's also the seniors, right? My dad is 86 years old. I don't want him going out, to be honest. He's got a hospital appointment tomorrow, and it's like that's probably where, if he gets it, is where he's going to get it from, right?
Yeah,
the hospital.
Yeah. So anyway, there's a lot of different points, but at some point in time, that's what you know. The politicians have to take the reins. You know, public health officials, they're not the ones that are supposed to be making the directives. It should be the politicians. They're the ones that you can vote out or vote in based on what they say, not the public health officials. Public health should be guiding and helping, but the politicians are the ones that need to take the reins on this.
All right, Don, we're at 29 minutes.
Okay.
Any last words?
No, there's going to be more words probably next Tuesday, but for this Tuesday, that's it. Thanks, everyone, for joining, and we'll see you next Tuesday. If you got a topic that you want us to cover, by the way, you can always send me an email, don@citystudio.ca, and we can cover it.
Bye-bye.
Talk to you later. Thank you.